Doctors are still learning more each day about the coronavirus and its effects. Latrice Curry spoke to a local neurological surgeon and has more in Eye on Health.
A new study shows that when COVID-19 hits the brain, it can lead to strokes and dementia-like syndrome, even in young adults. Neurological surgeon Dr. Joseph Miller says the coronavirus was first thought to mainly affect the respiratory system, but then doctors began to learn more.
They started publishing these reports about the effect of, like you mentioned, the vascular system having blood clots. First, it started out with like blood clots in the legs and the lungs. And then there was a pretty interesting paper that came out in the New England Journal of Medicine that looked at some pretty young stroke patients.
There were patients as young as 30 experiencing strokes who were only showing mild symptoms.
Normally you think of stroke as a disease that affects people in their 7th, 8th, 9th decade of life. The average age of some of these younger studies is about 55 years old, which is a pretty unusual age.
Dr. Miller says the outcome for a lot of these patients was even worse because they would delay care, thinking it's not that serious, but it is. Some of the classic signs and symptoms of a stroke are known as FAST, F-A-S-T, face drooping, arm weakness, slurred speech. It's time to call 911.
Your safest place is coming to the hospital because over the last 10 to 15 years, there have been some major advancements in stroke treatment and care.
This study published in statnews.com went on to show just how aggressively coronavirus can attack beyond the lungs and poses a serious risk to younger adults.
And it is aggressive. One of the most interesting thing is the barrier to our outside world is kind of our respiratory system, and with this infection, it comes under direct attack.
As coronavirus has spread around the globe, doctors have found themselves treating complications of COVID-19 in just about every bodily system.
It looks like these viral particles are actually directly invading the central nervous system and directly affecting these cranial nerve rootlets. And that's what's causing this early loss and change in smell and change in taste.
While we are still learning, medical experts say the most important thing we can do is to take precautions like wearing a mask, practicing social distancing, and get tested if you're showing any symptoms like cough, shortness of breath, or fever, or if you think you may have been exposed to the virus.
We are making decisions, day by day, case by case, on how to best protect our families.